Congressman Manzullo, this question is directed towards you. Over the past several weeks, we have seen rigorous debate regarding health care reform all across the country. The debate now seems to have shifted from a single-payer system to what is being called a public option. Can you please help us understand any differences between these two proposed concepts?
First of all, thank you for the opportunity to be here. Second of all, I want to introduce my beautiful bride, Frida. You want to stand next to me, Tom? It's a real joy to see everybody excited in America to be centered upon something that is so critical as the delivery of health care services. And the rigorous debate continues. I think this is our 11th or 12th open forum in the past couple of weeks that we've been traveling around a congressional district. I want you to know that I'm here. I'm not hiding. That many of my colleagues are in full retreat because they're afraid to face the people that they represent. And that's extremely important because as a representative of the people of the 16th Congressional District, it is my job to be with you in all types of weather and all types of debate, and I'm here tonight to continue to serve you, and thank you for showing up. There is no difference between a single-payer system and the so-called public option. The health care bill that was introduced This bill was introduced on July 14th with the instructions that the President have it in a signable form on his desk before we broke for the August summer work recess. It's 1,018 pages. And as a person reads through it, and I've read through it all, I've studied it with the eye of an attorney for over 80 hours on about 60% of the bill. The bill is designed so that no private health insurance company can succeed. It's absolutely impossible. Let me just give you a couple of examples. A private individual health care plan is grandfathered, cannot add any new enrollees. Whenever a public option is offered, which it has to be, an employee is automatically enrolled in the public option because that's the lowest employee cost plan that he can get. So how can employers keep more than one type of policy of insurance or program if his new enrollees, his new employees go into the public option plan as a matter of law? The third thing is that the different requirements say that you can't make any profit. It says very clearly that an insurance company that participates in the health exchange has to remit back to the insured the difference between the actual premium taken in and the cost paid out. So if private companies cannot compete, then that means that everything defaults to the public option. The public option rate of pay is Medicare plus 5% for the first 3 years. Now you could talk to any physician, any hospital. You cannot possibly pay your bills on that rate. In addition, if a person or a family is under 133% of the federal poverty level, which is about $20,000, those folks automatically are enrolled in Medicaid, whose rates are even lower than Medicare. So therefore, we'll end up with a system of insurance of Medicare and Medicaid for all. It will collapse the system. It will make it impossible for doctors and hospitals to meet their bills. And besides that, do you know who's not covered in this bill? Congress. You bet. Members of Congress, and 4 million federal employees. And when this bill came out of the Energy and Commerce Committee, with Henry Waxman as the chairman, Republican Congressman Roy Blunt from Missouri introduced an amendment that says that the president, the vice president, and members of Congress are covered under the public option. All the Democrats voted no, all the Republicans voted yes. I will not vote for a bill unless it applies to me and the rest of the 4 million workers who are insured by the federal government.
Thank you, Congressman. Ryan, we asked for a 1-minute rebuttal, a 1-minute follow-up, I should say.
Yeah, I'm not going to rebut that. I think Congress should be covered. There is no difference between a single-payer plan and the public option. The public option is designed to eliminate private insurance. The insurance industry has caught on to this, and that's why they're objecting at this point. Pure and simple, there is no possible way to compete with a government-subsidized program if you're a private insurer. We'll talk a little bit more about that. I'll save my time for the next one.
Aaron.
Just one observation that I want to make, and I agree wholeheartedly with both Ryan and the Congressman's remarks. You know, I'm a lawyer by training, and I've spent 20-plus years practicing law, trying to interpret the things that are written by legislators, et cetera, and then trying to enforce the things that need to be enforced. And I would suggest to you that as you go through this bill, I have mine on 2 sides, so it's a little thinner than the Congressman's version. I was trying to save a little paper, but I will tell you that it is intentionally vague. There is almost no way to interpret what has been written on the pages of a 1,000-plus page document, which makes it convenient for the proponents of this because, like the old joke you've probably heard about the accountant and the lawyer, the client goes to the accountant and says, "What is 10 plus 10?" And the accountant says, "It's 20." And then the lawyer goes, the client goes to the lawyer and says, "What is 10 plus 10?" And he says, "What do you want it to be?" And that's kind of how I read the House resolution. And I will tell you one other thing. I'm not here tonight as the mayor of Crystal Lake. A lot of you know that I am the mayor of Crystal Lake. But I would suggest to you that we spend more time and put in more analysis evaluating the impact of a development on the intersection of Ridgefield Road and Route 14 than the president and the proponents of this bill would have Congress spend passing legislation that will impact every man, woman, and child in America. And I think that is ridiculous.
Well, our next question I'm directing to Erwin. Michael Tanner